Something I unfortunately really commonly see in clinic is a student that's injured their hip through yoga. So they come into me and they'll say, I've got pinching or pain at the front of my hip, and I think it's being aggravated with yoga or when I sit a lot. So for these students, there could be developmental impingement that could happen through genetics, it could happen through the anatomical variation, or it could happen through hypermobility. For these students, what I'm going to do is create more opening through the front of the hip, which you can do through yoga too. But I'm also going to make sure that they're producing more strength through their glute to help create a bit more stability through the area. In the meantime, whilst they're building those things, what I want to do is also help them not continue to irritate the area by doing really deep hip flexion and abduction or a combined rotation. So for these students, you'll find that postures like lizard lunge, happy baby, chair pose with a twist, or revolved high lunge, that they're getting that impingement through the front of the hip. So whilst they're building on their glute strength and opening up through the front of the leg and getting more strength and stability through the hip, what we want to do is we make sure we're pulled back. For these students, you'll find that they've got incredible hip range of motion, but for them, it's actually not beneficial. So can you do even like happy baby and put a bolster or a folded blanket in between their hips so that they're getting less hip flexion? Can we do chair pose, but instead of doing that full rotation, maybe we stay in chair. Maybe we stay in high lunge and we don't fully rotate. Maybe for our lizard lunge, rather than going to the full depth, so that we're actually trying to create more stability in the legs and more strength in the legs to hold us there. So for these students, they'll actually find it harder because it will be stronger. They're actually, rather than just using their joint compression, they're actually using their muscles to hold them there. So maybe bringing blocks underneath their hands, maybe pressing back through the back leg of the lizard lunge to help engage the hamstrings and the glute of the back leg, maybe engaging their muscles of their shoulders to help provide a little bit of stability, and their core. So these are all different things you can help your students with if you're noticing that they're getting sharpness or pain through the front of the hip. Obviously, you want to refer out for maybe a professional advice as well. But in the meantime, these are hopefully things that will help.